So ladies and gentlemen, thank you for coming to our speaking session. We're going to present PCI outbreak, a model that offers a perspective on how serious the outbreak of COVID-19 in China has been. There are several contributors to this work, including Julian Chen from Bateswest Economic Consulting, Stephen Ho, which is me from Leidos, Kit Lee, Kawei Liang, and Weifeng Zhong from Mercatus. This is a very diverse group, and this group has data scientists, machine learning engineers, and economists. And we are all trained as economists and physicists. So it is this combination which makes this application of AI in propaganda study possible and efficient. So looking at the title, so you might ask, why are we doing this? The world has been dragged down by COVID-19 pandemic, and we are still yet to come out from it. China is one of the countries where the COVID-19 outbreak occurred before the virus was spread all over the globe. It is widely suspected that China didn't publish the numbers in time, and the official statistics have been inaccurate. So is it inaccurate because of the lack of administrative manpower? Or is it because they want to hide the real situation for whatever reasons? And how inaccurate is that? Can we ever tell? We cannot really read the numbers from direct observations, but we can tell from a different perspective. And as US-China tensions rise, it really matters whether we understand China now more than ever. There's a half joke about the economic measurement index, the Likert-Chiang index. It is a term coined by the economists, the magazine Economist. And this is a method preferred by Likert-Chiang, the current premier of China, that he deemed the economic figures reported by local governments are unreliable. He said that he would measure the economic development by the railway cargo volume, the electricity consumption, and loans dispersed by banks. Well, it is essentially a different perspective from the number, but it is useful, it is logically sound. Although we cannot count the number of the infected in this COVID-19 pandemic, we can measure it using tools in data science and AI, supported by tools developed by the open source communities. So it is easy to release false statistics outright in order to control the public perception. Without transparency, we do not really know how the numbers come about. To suppress public fear, the state media need to instill positive energy, However, it is hard to conceal the truth during such a big public health crisis just using the media. You can sense a thing if the number of the sick has been reported all-time low, but the news is all talking about, oh, the medical staff are still self-sacrificing themselves to contain the virus, or you should wear a mask, something like that. So the Likert-Chiang index, in our case, is the language style adopted by People's Daily, the China's state newspaper. It is kind of like Pravda in Soviet Union. So in our work, we use NLP, natural language processing, to read the tea leaves in People's Daily. It is one of the channels of the Chinese government to spread their own propaganda. So as a newspaper under an authoritarian regime, its language style has not changed much. Julian Chen and Weifeng Zhong did some policy analysis based on People's Daily a while ago, using tools in NLP in a previous project called PCI, the Policy Change Index. It checks People's Daily's consistency over time in propagandizing official viewpoints and intentions. It detects a short-term change in policy trend by measuring the change in the language styles In our study, the PCI-Outbreak, Policy Change Index for Outbreak, we used the news article on SARS outbreak in 2003 as a benchmark. The model is trained to learn the official epidemic language in SARS. Then the same model will predict COVID-19 articles date somewhere in between SARS as well. So from this, we can infer the situation of the pandemic. So that's the big picture. So let's go over in detail. So this is what we are doing. First of all, we prepare the training data, news articles in People's Daily in 2003. And then we come to our stage 1 model. Our model is a 2-stage model. It's a stage 1 model. The stage 1 model gives whether the article is pandemic related. So it is a binary model essentially. So it's 0 or 1, false or true. Yeah. And this model is a BERT-based model. It is a language model, transformer-based language model developed by Google. So we have a pre-trained BERT model, and then we fine-tune it using the training data we have, and then we have our own, we fine-tune our own supervised machine learning model. So when an article is going into this model, it will say whether it is relevant or not. If the article is found to be irrelevant, we ignore it, move on. But if it is relevant, we go to the next stage. Sorry. Oh, okay. Yeah. So the stage 2 model is a model that essentially gives a date, and this date is a SARS era date. And of course, if you put a COVID-19 article to it, it will be factually wrong, of course, but it will be very helpful. It provides hints about how the pandemic is like with SARS era as a benchmark. And it is also a fine-tuned BERT-based model, but this time the training model are not all the articles in SARS era, but it is the SARS era news articles related to SARS only. So the output is a date. And it is not a binary model. It is essentially a regression model, and its cost function is basically a mean absolute error function between the true date and the predicted date. And to use it, the input will be a COVID-related article in 2020. So what are we going to do with it? So we have our last step. So with the predicted date in SARS timeline, and in this step, we will have a normalized number of the infected. So it is essentially done by mapping using the statistics in SARS era. And this number is what we call the PCI outbreak. And this is the metric that we use to measure the severity. And this number is between 0 and 1, 0 meaning no case, and 1 being the peak, the maximum number of cases. So from this, here comes with our main result. So the horizontal axis is the date in 2020. The vertical axis have two things. First is the blue line, the PCI outbreak that we computed. And also the red line, the official number of still infected cases is a published statistics. So we can make some observations here. First of all, you can see that the two curves peaked around the same time. The official statistics is approximately 2 weeks after the PCI outbreak, possibly due to the sudden increase in 15,000 reclassified cases on a single date. So that's some artificial reason. So that's the first observation. And the second observation, that's very important. We found that the two curves diverge remarkably after the peak. So the PCI outbreak declined much more slowly than the official statistics. So it indicates that the government probably exaggerated the speed of containing the virus. That's the second point. And the third observation is that for the blue line, there's a spike in late May, early June, indicating there's a resurgence of new cases. That is the second wave in Beijing, and it is publicly acknowledged by the Chinese authorities in words, not in numbers, of course. Oops, sorry. So here's the main result, but we want to do something more. So as our model is an NLP model, we devised on our own. So since it is about NLP, it is about language style, one may ask, can we use sentiment analysis for the same task? So that's a good question. So we made use of the sentiment detection function in Amazon Comprehend, an AWS machine learning cloud service. So this sentiment detection function outputs sentiment scores of various types, including positive, negative, mixed, and neutral. And then we can see that the sentiment score measures certain emotion conveyed in the text, but not particularly specific to the pandemic. So we see that sentiment analysis is useful to a certain extent, but not giving a whole picture. It's not particularly to the pandemic. So, but we can do some comparison. First of all, we find that the sentiment scores are more correlated with PCI outbreak than the official statistics. On the other hand, the time series analysis shows that the PCI outbreak leads or gradual courses the sentiment scores more than the official statistics stuff. As the Chinese authorities know better about the real situation of the pandemic, as we can see, they can decide what to say in the newspaper to contain the public opinion. So from this perspective, PCI outbreak is a better indicator of the real situation than the official published statistics. And there's a second possible question. So does history repeat itself? What if things are very different from now from the SARS period? They might not write in the same way, or the language evolves, or we have a different writers, right? So we did a robustness check. We translated COVID terms in COVID period to SARS terms. So it's a simple replacement. We do the analysis again. So here's what we got. Oops. Here's what we got. So the blue line is our computed PCR outbreak previously, and the orange line is a translated PCR outbreak with the COVID terms replaced by the SARS term. And then we see that the differences are infinitesimal. So so the change, the time lag doesn't really change our result. So our model is very robust about it on this.
Stephen, you have 5 minutes left.
Oh, okay, cool. Yeah, I'm about to finish. So so here's our last slide. So thank you for listening. So we thank the open source software communities that makes our project possible. And the tools of data science out there in the open source world who really help in our scientific study. So if you want to know more about our work, you can look at the web page. the Policy Change Index, PCI, Policy Change Index.org. You can not only see PCI outbreak, but also some of the previous work, including the PCI and also the PCI crackdown, which is on People's Daily language style on the Hong Kong Democratic Movement last year. And also we have our code put on public repository. The link is here. You can take a look if you're interested. We also have a working paper. So so if you have any questions, yeah, you can also contact our correspondent, Weifeng Zhong, and his email is here. So that's it. Yeah, any question?
Great. Really interesting work. We had one question that came in about how do you evaluate the results of the PCI outbreak?
So the evaluation comes from the training data. By the way, Weifeng and Julian is also here. You can step in to answer. Yeah, so to evaluate our model, we look at our training data in the SARS period, and we got a very good very good accuracy recall and precision from according to our training data in SARS period. So that's how we evaluate our model. And our COVID-19 articles are new is our is our testing data, is a new data in our model. So of course we do not know the correct answer, but our benchmark is all in the SARS related period.
Okay, great. And have you thought about or have you applied this to other news sources to do the same kind of swap out for SARS versus COVID?
You mean the news, other newspaper, like other news media?
Yeah, other newspapers.
Yeah, that's very interesting. But we cannot use all kind of newspaper sources because in doing this work, one of the big assumptions is that someone want to control the propaganda. So it has to be some news source from authoritarian regime. So so in our case, so People's Daily is our main source of data. So if there's some other source of data that are controlled by the government, then it is possible that we can use that. But we cannot use New York Times, of course, because it's not run by the government, right? So so we cannot use all the kind of news sources, but yeah, we can use a certain kind of news sources. Yeah.
And my last question is, do you see a difference, I'm not sure in this project or in your other readings, in kind of the words that are used when you read news sources or like articles that are published in English versus articles that are published in Mandarin? Is there any difference between the two?
Yeah, that's interesting. Yeah, we know that People's Daily also have an English version, and it is a little bit different. We didn't work on that English version of the newspaper, but it's definitely very interesting to find out. Yeah, and the readers of the English version are actually international readers. So it would be interesting what they want to talk about to the international readers as well. Yeah, that's interesting. Yeah.